Hello everyone. Here we are going to discuss the important topic that is gastric carcinoma. In your university exam, very frequently you get a long question on this. You cannot afford this topic missing and it's very important topic, especially the gross and microscopy, the various gross types and the various patterns of the microscopy in gastric carcinoma. Here you can see we are starting gastric carcinoma, and if this long question is coming in your exam, you have to frame your answer, write your answer under following headings. So always I insist the students to learn the overview, because whatever I will explain you inside these headings, you will understand that. You don't have to mug up that. But whenever the long question is coming, it should be clear in your mind that you have to frame your answer under these following headings. So first of all, write down the introduction of gastric carcinoma. What is gastric carcinoma? Then write down its epidemiology. Then write down its etiology. Then the sites. Then I will tell you three types of classification. First, based on the depth of invasion. The second, based on the growth, macroscopic growth, I mean the gross. And third is the histology, I mean the microscopic. This is known as Lawrence classification. So if the gross and the microscopy is asked, you can write down this portion. This is the gross and this is the microscopy. The various patterns in the gross, the various patterns in the microscopy. After that, the clinical features, complications, and the spread we will see. So let's start the topic gastric carcinoma. What is gastric carcinoma? By gastric carcinoma, I mean the adenocarcinoma of the stomach. There are various tumors in the stomach, maybe gastric lymphoma, other tumors are also there, but the most common is adenocarcinoma. 90% of the gastric cancers are adenocarcinoma only. So if I say gastric carcinoma, I mean adenocarcinoma. I mean adenocarcinoma of the stomach, because 90% of the stomach cancers are adenocarcinoma only. So that is the introduction. Epidemiology, it occurs in which age? 4 to 6 decades, 40 to 60 years, relatively in old age. Again, it is more common in males as compared to female. Geographical factor, it is more common in Japan throughout the world. Throughout the world, most common country where it is common, it is in Japan. And racial factors, it is more common in blacks, American Indians, and Chinese. So learn the age, gender, geographical factors, and racial factors. So these are the four things you have to understand in epidemiology. So we have seen the introduction. In the epidemiology, what is the most common age? What is the gender wise? It is common in males or females? Tell me regarding the geographical, where it is geographical distribution, where it is maximum, and according to racial distribution, in which race it is maximum. So age wise, it is common 40 to 60 years. Gender wise, it is more common in males as compared to female. Geography wise, it is maximum in the Japan, and race wise, it is maximum in Africans, American Indians, and Chinese. So this is how you have to learn the epidemiology. After that, come on the etiology. Now in etiology, I will discuss two factors: the factors that increases the risk of gastric cancer and the factors that reduces the risk of gastric cancer. We will be discussing two factors: the factors that increases the risk and the factors that decreases the risk of the gastric carcinoma. The factors that increases the risk. The factors that increases the risk of gastric carcinoma, we will divide them in three categories: environmental factor, genetic factor, and host factor. In the environmental factor, H. pylori is the most common. H. pylori increases the risk of gastric cancer. The nitrites in the diet, nutritional deficiency like vitamin C, vitamin E deficiency, and smoking. So these are the environmental factors. Among genetic factor, family history of gastric cancer. If any first degree relative is having gastric cancer, the chances become twice or thrice in that person as compared to a person who don't have any family history of gastric cancer. It is observed that the person who have blood group A are having high chances of blood cancer as compared to other blood groups. The reason is not known, but it is a genetic factor. Now in hereditary non-polyposis colon cancer syndrome, there is increased risk of gastric cancer. And familial gastric cancers are there due to E. cadherin mutation that runs in families. Among the host factors, these are the benign diseases. In future, the risk of malignancy can be there. So all these are the benign diseases of the stomach, like chronic gastritis, intestinal metaplasia, partial gastrectomy, gastric adenoma, Barrett esophagus, and Meniere's disease. These are the benign diseases, but they increases the risk of malignancy. So these are the host factors. So these are the factors that increases the risk of gastric carcinoma. Among them, most important is H. pylori. How does H. pylori causes malignancy? Most important is H. pylori. Most important risk factor. If you can learn all, it's good. But if you can't learn all, the most important is H. pylori. H. pylori causes mucosal irritation of the stomach. Can you see the H. pylori? It is causing irritation in the mucosa of the stomach. Since the mucosa get irritated, there is less acid secretion. Because of the inflammation, there is less acid secretion. Less acid secretion further attract the bacteria. So more bacteria, more inflammation, it's a vicious cycle. And ultimately, the mucosa get atrophied. First atrophy, then metaplasia, then dysplasia, and then carcinoma. This is how H. pylori causes carcinoma in the stomach.